Hi everyone, it's Olivia Henry from the New England QIN-QIO. We're going to get started. I'm going to go ahead and mute all the lines. So you should hear a command that your lines have been muted.
The leader has muted your line. To unmute your line, press pound 6.
Good afternoon everyone. Thanks for joining us today for today's webinar, Session 2, Interact Webinar, Hospitalized Rate Tracking Tool with Carol Deese, Sheila Eckenrode, as well as guest speaker Dr. Adrian Mihalik, who will introduce in a few minutes. Before we get started, I'm going to quickly review a few housekeeping items. This call will be recorded for training purposes. I'll provide you with details on accessing the recording at the end of this webinar. The phone lines will be on mute for the duration of the presentation, and we'll take questions at the end, and I'll provide you instructions on how you can unmute your line. Just a reminder to everyone that you must individually register for each webinar. The participation agreement that you signed is a separate document. So please look out for webinar invites and click the Register Now button, and then you can follow the prompts to register. If you don't register for each webinar, you're not going to receive a confirmation email with the info to access on how to access the webinar. If you have any more questions on that, you can direct it to myself or Sheila, who can then pass it over to me probably. So at this moment, I will now pass it over to Sheila, who will get us started and introduce our speaker.
Good afternoon and welcome. We're glad that you're here. Today we're going to talk about the 30-day hospitalization tracking tool and how to use data. And we know that data is the cornerstone of any quality improvement effort, that we can't know which direction we're going in if we don't have some sort of measurement. I equate it to what I usually do with diets when I say, I think I'm losing weight, but I'm not going to get on a scale and be proven wrong. So this is a very, very important topic, and it's one that sometimes facilities struggle with learning how to use the tool and getting it set up. So we're going to walk you through that. But I want to make it perfectly clear that after Dr. Mihalik's presentation today, I'm available, we're available to help you to even come out to your facility and kind of walk you through this. This is really, really important that you use this tool, that you enter the data, that you give Qualidigm access to see the data that you've entered, so we, in turn, can give you credit for that towards your participation certificate. But much more important than that is that the data goes in, you have some rates, you have some reports, you have a compass, if you will, and you have some instrumentation to fly this improvement effort. So the objectives of today's session are to understand the National Nursing Home Quality Improvement Campaign Safely Reduce Hospitalization Tracking Tool. That's a bit of a mouthful. To understand what it is and how to access it. We want to show you how to download and save that tracking tool to your computer in the facility. Dr. Mihalik will describe some technical support resources available through the campaign itself. And she'll touch on how to use that readmission data for quality improvement initiatives. But we're going to talk about that all through the webinar series, because it's such an important piece of any quality improvement effort, as I said, to look at data, to show it not only to your administrator but to your staff, so people can get together, react to it, understand it, and interpret it, okay? And we will have a 15-minute group discussion. So before we get started...
it sounds like we have a little bit more background noise, and I would like to just make sure that all the lines are muted before Dr. Mihalik begins her presentation. So I'm going to go ahead and unmute and remute the lines. Sorry for the interruption. I just want to make sure that there is no background noise. So one moment, please.
The leader has unmuted your line. The leader has muted your line. To unmute your line, press pound 6.
For that. So we'll start with a polling question. If you could, are you using the hospital tracking tool now, the National Nursing Home Quality Improvement Campaign, the NNHQI tracking tool, formerly known as the Advancing Excellence tool. So if you could take a moment and answer this question, be sure to hit the submit button after you answer it. Just yes or no. So we're opening that polling question now. Great. We've got a few folks using it and a few folks not. So thank you for that. And as I said, by the end of this webinar series, we'll all be using it. All right. I would like to introduce Dr. Adrienne Mihelic. We're very glad to have her here. Adrienne's a gerontologist and a biostatistician for Telligent, the quality improvement organization based on the West Coast in Colorado. She oversees the nursing home quality campaign and develops the data collection tool, including the hospitalization tracking tool we're discussing today. So we couldn't find anyone with more authority or knowledge about this than she. Thank you, Dr. Mihelic, for coming. We're glad that you're here, and we're going to pass the mic over to you.
And Dr. Mihelic, if you want to press pound 6 to unmute yourself. We will pass the ball right over to you. All right. All right, Dr. Mihelic, you have the ball.
Hi, am I unmuted now?
Yes, I can hear you. Sorry about
that. Okay, good. No, it took several times. And one thing that we did not discuss beforehand, please call me Adrienne. It sounds very intimidating, and I'm not at all an intimidating person. That was just an endurance project from a really, really, really long time ago. So, Adrienne, thank you so much. I'm really happy to be with you all. And this is one of my favorite projects. I really love talking about this tracking tool, and I noticed that actually the majority of participants did not indicate one way or the other if they're already using the tool or not, which may mean that you're kind of starting, but you don't want to really endorse that you're a full user, and that this will probably hit a sweet spot for you if that's the case. Those of you who are already using the tool, we're hoping that there's going to be, first of all, a new tip or trick along the way for you. We're really hoping that there'll be something for everybody. The first part of the presentation is going to be dedicated to those who haven't started using the tracking tool yet. So if you have been using it, my challenge is to listen for something you didn't already know. This is kind of like looking for Easter eggs. So listen for that thing that's a little bit different than maybe how you've been doing it, or just adds a little nuance. Or you might notice something that I missed discussing. And that's going to be obviously very important too. So when we get to the end of this section, I'm going to ask for any Easter eggs you might have found, as well as other recommendations from your own experience that you have for the newbies. And also, just to go back to the slide. So as was just noted, in September of last year, we changed our name from Advancing Excellence to the National Nursing Home Quality Improvement Campaign, or you can say NNHQI campaign, and we just like the campaign. And the main thing that changed is we got this really cool little house for our logo. So just keep looking for that, our little home. Okay. And it looks like I did not know that I had an animated slide here. Let's see what happens. There we go. Okay. These are the pieces of information that we are referring to when we talk about required fields. There are a total of 8 things you're going to enter really every day, ideally. But you're not going to enter them for everyone. So what we have at the top is daily, only for residents that are admitted to your home within 30 days of a hospital discharge. Their name, the date they were discharged from the hospital, the date they're admitted to your home, very often the same date, but not always, and status on admission to your home from the hospital, which, generally speaking, is going to be Part A or other. Then, and this is separate, and it actually happens on a separate page, only for residents who are transferred to the hospital. Again, 4 pieces of information: their name, the purpose of the stay, whether they're getting post-acute type care or long-term type care, the date of transfer to the hospital, and the outcome of transfer. Talk about that more in a minute. Then monthly, for the whole home, you're going to enter your average daily census. Okay. So most of these pieces are going to be, especially for the residents who are coming in and those who are going out, are going to be already available on a daily report that you might get. But there are 2 exceptions. And one is the outcome of transfer. That's special. This means whether the transfer resulted in an inpatient stay, emergency visit only, or observation stay. And that's not something you can know by sort of looking to see how long they were in the hospital before they returned. And in many communities, we've discovered that the nursing home actually needs to establish a contact at the hospital to get that information regularly. Once you have that established, that's going to be an easy thing to get, and it's actually a very important thing for you to have even outside making this tool work well. That whole process is something that some of the old-timers may have tips on, of course. The other special item is your average daily census. That's a number your business office can help you with, and you'll need to get that from them once a month. This is a helpful tip slide. So before you start, we want to make the addition of new data entry tasks as smooth and as efficient as possible. The idea is to find a home for that new task that fits in with as little impact on your current process as possible. So take a look at your daily report or your daily census and see how many of the required daily items it already has. Could it be modified to include more? Is there another format? It might be relatively easy to switch up the format so that it has the information that you need right handy for you. So just work it into that existing process. Think also about who can best enter the data with the least impact on schedule. Remember, it's only going to be a few items each day. The exception is if your community specializes in short-term rehab and you have a lot of turnover, then it may be a slightly more substantial project, and that's something that we're always happy to talk with you about. But think about who would be best to do that. It might be for office staff, medical records, admissions staff, and get that daily report routed to the person who will be entering that data on a daily basis. So we're really thinking that it's usually between 5, 10, 20 minutes, depending on how much you have on a day, but maybe averaging about 10 minutes a day. And again, please let us hear from those of you who have been using it what that time commitment is. That will certainly help with the planning. Okay, remember this slide for your homework. Remember that this one is here at slide number 8. And this has the answer to one of your homework items and one of the objectives for our session, which is download and save a copy of your tracking tool to your computer. We could go out to the web and I could show you how to do that, but honestly, as sort of boring as PowerPoint slides are, I think it gets really confusing. It's sort of like watching somebody else split channels and you don't know, did we just change from the main show to a commercial? Or did you actually change channels, right? You don't necessarily know where somebody's clicking to show what's happening. So I kind of prefer to give you a static slide so that we can all reference them and you'll have them later to look at. So this is here for the tracking tool. It answers that second objective of download and save a copy of your tracking tool to your computer. All the information you need is right here, including how to get to the tool. Read this text. It tells you what you're looking for. You're actually not looking for an Excel file. It's a zip file. And you want to open that folder all the way up. When you can see the front page, which says welcome, it's going to look really different. It says welcome, and you're clearly looking at a document. It will be in Excel. Then save it, do a save as, and put 2017 at the beginning of the file name so that you know it's your 2017 workbook. Now, the reason that I have the slide here, not with homework, is because we are going to take a look at data entry within the workbook. I'm going to show you screenshots from within the workbook. So remember that while you get the workbook from the website, you won't be doing your daily entry on the website. The tracking tool is an Excel workbook. You're going to download it and save it to your computer. It will contain PHI once you start entering data. So please take care of it the same way you would with any other medical record. And please do not email your workbook. It would need to be encrypted or de-identified first. The first tab, and we're not looking at the workbook, this is just a slide. The first tab or worksheet that we're going to look at is the Admitted with Recent Discharge tab. So remember, we looked at 4 required fields for each of 2 different worksheets. So this one is for people coming in. Admitted with Recent Discharge is a long name, but we chose it on purpose. Lately, one of the mistakes I've been seeing is that people start to refer to this as the Admissions tab, and they record information for all residents admitted to their home, whether or not they had a recent discharge. Please don't do this. It will make your calculations incorrect. If you want to shorten the name, call it AWD, Admitted with Discharge. And what we mean by that is that the resident was admitted to your community with a recent discharge from an inpatient hospital stay. So, most of your residents may be coming from the hospital, and you're aware of that because they come directly from the hospital. The hospital has transferred them directly to you. In which case, the date that they are admitted or discharged from the hospital and the date they are admitted to your home is going to be identical. But sometimes the hospital will discharge the resident to their home or to an assisted living or to another long-term care community. And after a few days or a few weeks, but still within 30 days, they come to you for any one of many reasons. So that may be a new thing that you need to be asking. Think that we would all know that somebody came from a hospital, but as it turns out, that is a transfer that sometimes is overlooked. So no matter who is being admitted, we want to have that discussion as part of the admission process to talk about any recent hospitalizations and make note about when they occurred. And if they're still within that 30-day period, you're going to record that admission to your community on the Admitted with Recent Discharge, or AWD page. This is the screenshot from that page, from the Admitted with Recent Discharge page. And see how we have columns? The ones that have the red asterisk are the required fields. There's just 4 of them: the resident name, the hospital discharge date, date admitted to nursing home, and there's going to be one more, which is kind of the payer status at the time that they were admitted. And you're typically going to just revert to Part A or not. Some communities are a little bit different. If you have primarily Medicaid residents, we can talk about how you want to address that. As you enter your Admitted with Recent Discharge events, you will notice rows that are highlighted yellow. The rows that are highlighted yellow indicate residents who have been discharged from the hospital within the past 30 days from today. Statistics tell us that more recently a person has been discharged from the hospital, the more likely it is that something will happen that results in a return to the hospital. Many of those transfers are avoidable, and that is the work that you're doing with the whole Interact program. And of course, this data collection is a very important piece of that. So one of the first things we can do is to keep an extra close eye on residents for the first 90 days following a hospital discharge. And of course, encourage staff to use a stop and watch. We can also institute a routine of daily hospital walking rounds. So here's the tip, another way to get a little more value out of your workbook. The person entering data can actually copy this information out, the resident's name, the date they were discharged from the hospital, and the date they were admitted to your home. Copy that out into a Word document and bring that to morning stand-up. And they can even just set up a Word template. So they replace the information and this is today's report every day, and then this can be something the charge nurse may be doing walking rounds and can actually be looking and working with the CNAs to look for subtle changes in signs or symptoms that may, if not caught early, precipitate a return to hospital. The important point here is that we're taking information that the workbook generates and getting it into the hands of someone who can use it. So keep this information actionable. Now we're going to look at another tab in the workbook. This worksheet is called the transfer log. So down here at the bottom of my screen is it's a little top section, and we're going to look at more of it. This one is called transfer log. Remember, again, only 4 fields are required here, and you'll only record those 4 fields when a resident has an unplanned transfer to the hospital. Not all transfers out, not discharges home, but all unplanned transfers to the hospital. The arrow here indicates that special field that we talked about before, the outcome of transfer. That field is and so it's separated a little bit from your other 3 required fields. And that one is critical, and you may need that new process to obtain the information regularly. Okay, more information you're going to get just from entering those 4 required fields for those coming in and those coming out, those specific cases, what we talked about. On both your admitted with recent discharge, AWD, and transfer log, events that are part of a 30-day readmission will be highlighted that pink with red font, and those that are part of a 90-day readmission are going to be highlighted green. The highlighting identifies cases for additional review as you look for patterns and opportunities to improve. A number of communities I know are actually, the hospitals are meeting with our nursing homes and doing some RCA, and they want to talk through the details on individual cases to see where did we have an opportunity to improve, and how can we work together to try to reduce transfers of that kind or returns to hospital of that kind. Just by entering the few required fields we've been discussing, and I think that was back on slide 6, that's another one to note. Slide 6 has your required fields. You'll get 5 outcomes. Everything on this page is calculated for you. There are 12 pages that look like this, 1 for each month. So look down here at the bottom. So this is the actual worksheet within the Excel workbook. And at the bottom, they look like file folder tabs, so we often call them tabs, and each tab that you click on opens the sheet, and there's like a piece of paper inside. And you can click on these to move, but when you first open your workbook, you are not even going to know that there's a January, February, March, April, May, all the way out to December hiding in here. So use these scroll arrows on the lower left. You probably all know about this scroll bar on the lower right. That will move you back and forth within a particular page. You want to use those arrows on the lower left to actually move so you can see the rest of these. If I continue to click on this arrow pointing to the right, that would take me over so I could see October, November, and December as well. All these outcomes are calculated for you. You don't need to do anything on this page, but there is something you need to do with this page. So we are on the same worksheet here. See these table numbers below? And what I've done is just to scroll up to the top. So on the last slide, I was focusing on how to move around and how to find these tabs with this worksheet. Now I'm showing you the top part of it. So it's actually, I'm on March. I can see March down here. This is my March monthly tab. You can see March up at the top. And now I've got a lot more information with instructions about when the data is ready to be entered on the website and a link. So the yellow dates tell you when it's time to transfer your monthly data to your account on the campaign website. And you do have a handout. If you haven't received it already, we'll be getting that to you about checking to make sure if your home already has an account on the website, and if not, how to get it set it up. If you do, but you don't know how to access it, how to do that, we have all that information for you, and we'll make it as easy as possible. So for this, the brief instructions are right on the tab, along with a link to the website. And for this part, if you want a little bit more information, we do have a detail handout on that. If you misplace it, it's posted on the website all over the place, but including right on the webpage where you get your tracking tool and the general instructions for the tracking tool. So let's say I click this link here to go to the campaign website, and I log in, and I follow those instructions to choose Hospitalizations. I am going to get to a page that looks like this, except that it's going to take up my whole screen. Okay, this part right here is my web page. So I log in. I choose Enter My Data. I go to Hospitalizations. I choose the goal that I want to enter data for is Hospitalizations. And those are going to be kind of obvious prompts, but they're right there on your Excel worksheet page. And then I select the date. And I'm going to tab through each of my 3 state types. So this part where you're going to transfer your data every month literally takes about 2 to 5 minutes, and I am not kidding you. So you're going to get here, you're going to know the stuff really well. It's 3 clicks. You're going to choose 2017. You're going to start with post-acute, and this may be a little small on your screen, but just look where I'm moving my cursor. Here you're going to change this to 2017. It's going to default to post-acute care. PAC stands for post-acute care. And you're going to type in for, let's say your first month, we'll just say that your first month is January. You're going to type in your 7 numbers for January, going right down this January column. Then you're going to go to long-term care. Type in 7 numbers right off that worksheet that you will have printed. Then you're going to go to the All tab, type in 7 more numbers right down that column. Then you're going to click the Submit button. Or you can click the Submit button every time you enter any data. Remember to click the Submit button. Okay? And that right there is the full enchilada on using the required fields and getting the data actually entered on the website. So I wanted to stop here for a few minutes and hear your questions, hear what the old-timers found in the way of Easter eggs, the things that I miss, any tips that you have for others from your own experiences, and questions or comments of any type.
Thanks, Adrienne. It's unmute yourself if you would like to pose a question or talk over the phone. You can press #6, or you can pose a question in the chat box or a comment in the chat box. Just make sure to send to all attendees. So again, #6 or all attendees in the chat box.
Hello?
Hi, yes, we can hear you.
All right. I had a question in regards to the data entry. The admitted with recent discharge, do you have to do that for everyone that's being admitted to your facility, or can you just put that information in for people that are being transferred to the hospital?
That's a really good question. It's actually creating the denominator for your 30-day readmission rates and for your 90-day readmission rates. And so if you only put in those who go back out again, in other words, if you sort of do the work for the workbook for it, what you'll see is you have 100% readmission rate.
Well, yeah, not if they're not admitted, but I see what you're saying. Okay.
No, right. You'll have 100% readmission rate. Yeah, right. Okay, right. Only if you also only record on the transfer log those who are admitted as an inpatient.
Yeah, like right now, that's how I did it. I'm looking at it, and about half of my columns are pink. I got a couple of yellows, and the rest are white, and that's just from the ER visits. But okay, that's going to be definitely the time-consuming thing moving forward here.
Good clarification now, and your rates are going to look better.
Yeah.
This has got to be the easiest way to reduce your readmission rates.
Okay, very good. Thank you.
I'm sorry that you're going to have to do some rework, though. I do understand the pain.
Yeah. Thanks.
Adrian, it looks like we have a couple questions in chat. One from Julie that says transfers for psych eval also be included?
Oh, that's a great question. Okay. So, for a psych eval, let me tell you, we actually are going to need to go to the actual tracking tool because I am no longer, there's some really specific instructions about when to include psychiatric hospitals and when not to. I think when you, and so I can look at that, but if you're doing a transfer for a psych eval, if the situation is this is unplanned, that you are having, and maybe I should ask you to give me a scenario. If you're, Julie, if you're willing to actually take yourself off mute and tell us. But if you're basically presented with symptoms and you transfer the resident to emergency room, to a regular acute hospital emergency room for psych eval, you would count that. Did I hear you come off mute?
Julie, pound 6 to unmute yourself.
If it is a planned transfer, for example, so I'm just going to go, I'm going to assume that we don't want to get off mute or that there are technical difficulties until I hear otherwise. If it's a more of a planned transfer, we have an ongoing situation and we need to transfer the resident out. They're going to go to a hospital of some kind of any kind to do a psych evaluation and then come back just as we might be sending a resident. It's a planned diagnostic visit, but we need, for example, MRI or CT or something like that. And so we're transferring the resident to the hospital. It's an excursion, essentially, to the hospital to have diagnostics done. And they're going to be returning to us. And this is not an acute situation. It's not an acute transfer. We're not going to record that either. This is really something that looks, you know, it's going to start with an emergency room, typically, entrance, and then progress either to an observation, a stay, or an inpatient admission. That's it for a minute. There's another question about point-click care. If you are using point-click care and you have access to your 30-day readmission rates, you will not get the 90-day readmission rates, but you have the 30-day readmission rates, and those are specifically calculated to match our calculations, and it's going to look just an awful lot like what you have here. And you can take those from point-click care. You do have to transfer them over here, but that's going to be a portal so that Qualidon can access that for you, and you will get our graphing, which is pretty neat, and we'll take a look at that in a minute. What you won't have is some of the other process tracking. And there are other ways to do that, and you may have other forms. Certainly these things are available through the Interact package. It's more paper and pencil. But you could set up a little Excel spreadsheet for yourself, or you may have some other way of doing it, and I'm going to let the rest of how you manage that be something that you work out with Qualidon in terms of what you collectively need for your project, to do your quality improvement project. So just keep that in mind. But certainly we want to reduce duplicate effort wherever we can. The idea is that any effort you put into this gives you some value, and if it doesn't, then we need to work at either making it have value or figuring out what you need to be working on instead, if this isn't giving you any new information. Okay, regarding psychiatric evaluations, PC to psychiatric hospital unplanned. Yeah, you know what? Let me, can we make a note of this question, and I would like to follow up afterwards, and we'll be sure to get the answer back to everybody. And let me tell you, in fact, let's go through our questions. If we have a minute at the end, would somebody remind me? I can pull up the tracking tool and show you. Actually, let me do that right now. Let me tell you. When you download your tracking tool, at the top of the transfer log, there's some notes about which transfers to include. Take a look at those and go. There's also a tab within the workbook called Common Q's and A's. Highly recommend that you review that. Doesn't mean study it, look at the different topics, the questions, the answers, get a sense of the kind of information that's there so that you know that that's a good go-to source when certain kinds of questions arise. Specifically addresses when to record comings and goings from psychiatric hospitals. Because there's a point at which they're not included, actually, in these calculations, or you don't want them to be included. And then we can also follow up on the help desk as needed. That's a good question as well. Any other questions on the voice? That's it for chat box for now.
We actually do have another question, I guess. We can even save it to the end, Adrian, or would you rather do it now?
Oh, I see that, the 90 days. I'm so sorry.
Yeah. And above that was a question, I believe, about PECs, people going to the emergency department for a psychiatric admission. And I know, I just know in the CMS world, psychiatric admissions are counted as readmissions, so I'm just going to let you take that. But, I'm assuming that this is referring to a patient that was perhaps PEC'd at the facility and then transferred for psychiatric hospitalization, which is still an acute care hospitalization. But, Adrian, I'll let you can see the question, so.
So that's one that I want to follow up with after. At the time that we were putting the logic programming into the tool, we were following what CMS had not come up with their measure yet, and we were following as closely as we could the way those calculations were being structured. These calculations will never match those because they're using claims data, but in the spirit of things, what gets tracked and what doesn't. And what I'd like to do, because it is a complicated situation, is go back and review exactly what the workbook is doing and what it's expecting you to do. And certainly, you can always count whatever you want to count. So if you think that this is potentially avoidable and you want to track it for your quality improvement project, please do. And that would ultimately be the bottom line, that you're doing this for yourself to be able to see where you have potentially avoidable transfers to hospital and look at ways to address those upstream, primarily by adjusting processes and better implementing processes. And everything else that the folks that Paul and I are coaching you on. Okay, for admitted with recent discharge, to get your 90 days prior to now, that is a great question. Your 90-day, and this is the same for 30 days. If we start using the workbook in April, we go forward, and our April 30-day admission rates will be mature when our data has been entered for 30 days out, and our 90-day readmission rates will be mature when we've entered data on our transfers for 90 days out. From the last day of the month, so we count from the end of April, because everybody who had a discharge from the hospital in the month of April is potentially eligible. They are in your denominator to become a readmission. And so then we watch them going forward. And that ultimately, even though this is not the question, that ultimately can become important in terms of looking at your readmission rates, because you may think that a readmission rate should be either higher or lower than what it's looking like. And the reason is that you may be looking at, we had 4 people this month that we transferred to the hospital and they were readmissions. They won't necessarily count in, let's say we transferred them in May. They won't necessarily count as a May readmission unless the discharge from hospital happened in May. Other questions, comments, tips? Anyone who's been using the workbook, have you had difficulty getting the outcome of the transfer? Or is that something that anybody anticipates difficulty getting? Learning whether it was emergency or inpatient or observation stay. Or any tips on who should be entering the data to make that the easiest flow. Okay, well, don't hesitate to chime in or continue adding questions to the chat box. I'm going to go through, I have a handful of other slides. Let's go through those, and then if we have a minute, I'm going to take you in and show you where that Q&A tab is, and we can look at the psychiatric transfer question, and then also your Qualidigm team has some homework items to follow up on. So, let's see. I have a very small place I need to click to make the slides turn, so sometimes there's a little lag there while I'm getting coordinated. So we really want to emphasize that using the tracking tool is not about recording data for the sake of reporting the data. And I just mentioned this, but everything you put into the tool should give you something useful in return. And we have seen a couple of examples of this already just from entering those required fields. You get the 30-day readmission rate and the 90-day readmission rate highlighting the residents who are at the high-risk window following a hospital discharge. And that's really actionable information. You can do the drill down on the root cause analysis within your team or partnering with your hospital on those readmission rates, and you can use that list of residents who are in that known higher risk for readmission window of 90 days and institute daily hospital walking rounds, and using that as a hook, as a first priority area to be using in the SBAR. Well, let's talk about about the outcome measures that you're getting that we looked at on the last screen. We talked about the outcome measures, those 5 outcome measures, and there's actually 7 numbers because we include denominators in there, and how we're going to use them, and some other things we can get. So I'm going to flip through a few slides. It's really as a teaser and to show you what else is available and provide the next step for those who are ready to move on to this part. And there will be more time spent on this in a subsequent webinar, and we're always available to help you with it at the Campaign Help Desk. So please don't worry if this feels like it's going a little fast. And one of the reasons is that it shows a lot of neat information that we would want to dwell on. This is a slide of the trend graph of 30-day readmission on the website. So when you transfer your data to the website, that slide that we just looked at where I said it should take you about 2 to 5 minutes a month to transfer those 21 numbers over, that process we just looked at, your monthly data will be turned into very cool, if I do say so myself, trend graphs. Not everybody gets excited about trend graphs, but ultimately you will. I promise. You'll have your own graph like this that you can access from your website account. Remember that your quality improvement process is fundamentally a series of small tests of change, and then eventually also spreading those successes. Your trend graphs tell you if your changes are resulting in improvements. So remember that quote, not all change is good, but all improvement requires change. As you test your change, you will be coming to this trend graph to see if your rates are going down, if they're going up, if you can sustain a downward trend, or perhaps you might have a plateau where you've achieved something good, that the project has stalled. So this is really kind of your speedometer in a way. Note that you can opt to select the time frame you want to look at. You've got some buttons down here, 1 year, year-to-date all, or just 6 months. You can also further customize it by moving these little circles up at the top with those little bars in it. They're a little squirrely, but you can move them around and really isolate a specific area that you want to look at. You get a campaign-wide median, and this is a choice. You can choose to display the campaign-wide median, and so you can see how everybody else in the campaign is doing. Note that they are different places in their project. Some have been entering data and working on their quality improvement project for a long time, and others are just beginning. And you can set a target for yourself. We really recommend using that target setting feature We know studies have shown that homes that set targets for themselves actually improve more than those who don't. So set a target and actually set it aggressive. Those who set more aggressive targets improved even more. And on that note, be sure to print out your trend graphs and share them around. Think about annotating them with changes that you've made along the way. Put little arrows and notes on them. You can do it electronically or with your pen, and just note what you changed or what happened, or you get a C. diff outbreak or flu, or whatever you have. And you can get these not just for your 30-day readmission rates, but for all your transfer rates. Okay. These are just teasers. They're bar charts that are in your Excel workbook. They're not online. Those trend charts are online on your website account. These are actually within your workbook. They are printable, and you can also customize the date range that they're referring to. And these particular bar charts come from the required fields only. There are several charts like this one that have some very juicy information, and they come from the additional fields. One includes a non-clinical reason for transfer, like clinician wasn't on site to do an evaluation, family insisted, or diagnostic services not available on site. And you can get some more trends. This is again from within your workbook. So there's outcome trends on the website, and that's your ultimate meter for how your project is going. But to make changes in the outcomes, we usually have to make changes in processes. And the processes themselves, they make great intermediate goals, because you can often see success in in implementing changes in processes before you see the changes in the outcomes themselves. So that can be a really nice thing to have on board as you're waiting to see a change in the outcomes. If you're interested in getting some of that additional data, I have 2 slides to help you kind of dig in. I'm going to go through them quickly and hopefully leave us with a little more time. The next steps, if you're ready to move beyond just the required fields, this part, and so mechanically, that's an easy thing. You just enter the data like you're going to be entering the other data, and the fields are there, and you'll be able to see where they are, and it's all drop-down lists. The really important part is about the conversation and the process that you use to collect the data. It's a lot more than just questions and answers. So the data and the additional fields in the workbook, to get those juicy extra charts and trend graphs, you'll want to implement what I'm calling, for the sake of our discussion today, a post-transfer huddle. This is super important. The idea, what we don't want to do, is have somebody sit down the next week, and this really happens a lot. They sit down the next week or a couple of weeks later or the next month, and you have somebody who's entering the data who may not even be a clinical person, going through medical records and trying to piece together what happened that caused that transfer, that precipitated the transfer. What were the circumstances, and what was it that staff were actually experiencing in terms of signs, symptoms, and other non-clinical conditions, like family was insisting, or we couldn't get the clinicians that needed to order the transfer to actually come on site and do an evaluation and potentially not do the transfer to hospital, but they were doing the transfer because they couldn't lay eyes on the resident themselves. That's the discussion that we need to have, and it doesn't necessarily show up in the medical records, and nor is it efficient to have somebody going through medical records trying to piece together. So what we want to do is this post-transfer huddle as soon after the transfer is possible. So later that day, next day, but very soon, gather a small group of people who are directly involved in the transfer. It's typically going to include a charge nurse and 1 or more CNAs, and it certainly might include others as well. And as the slide says, when done right, this step is a core part of your QI project itself. If you do this and you do it well, you're really starting to create a culture of QAPI. So if you're going to do that, the first step is there are 2 documents I'd like you to get. One of them is just within that tracking tool that you will have already downloaded. It's a tab, a worksheet that's called Data Collection Worksheet. You don't do anything on it in the tool. What you want to do is go in and print out a bunch of copies of it. And it's a summary sheet. The other one is the Interact QI review tool, and this is a fabulous guide to doing a root cause analysis. And it will, down here, it's going to guide your discussion. And the way you use that Interact QI review tool, and you'll talk more about this in another webinar, is to use the parts of it that matter. You don't have to address every single thing on it. It's really a larger template to capture everything that is salient to the transfer at hand that you're discussing. Assign somebody to be a scribe. That person is going to hold this data collection worksheet, and they're going to make the notes on it. And that essentially documents the result of your root cause analysis, your RCA. And then finally, now you've got this one-sheeter, that can be passed to the person who's entering the data in your tracking tool. And that's going to include all the information that they're going to need. It's going to be sweet for them to pick up that one sheet, enter the data. It's not going to take them any time at all. And it's going to get recorded. And then that information gets summed up and aggregated into those charts and graphs that you can use to really determine where your opportunities to improve are. Okay. So, do not panic. This is actually, we could just have an easy button here. This slide and this address needs part of your objective of knowing your support sources for help with the workbook and website entry. Please write to us at the help desk, and we can always schedule a call and do screen share as well. We'd love helping troubleshoot with your workbook and discuss your quality improvement project. And of course, your first source is always going to be your Qualidine tool.
Could you please go back to the other slide?
Yes,
prior slide?
Yep, here we go. This one? So you should get a copy of these. Am I right that you're going to post the slides or send them out?
The slides should already be available on our event webpage. I will send the link out right now, and those who registered for the webinar, there was a link in their confirmation email that went out yesterday, but I will send them again in a thank you email tomorrow.
Great. And a tip for accessing these links, you have to put the slide deck in slideshow mode in order for that link to work, or you can just copy it out and paste it into your browser.
The links are actually available. It's in a PDF. People will be able to access it in a PDF, so you should be all set.
Okay. There's a question in the chat box. If you were using the Advancing Excellence website for information prior, does it carry over to the new site? Interesting question. It is exactly the same site. It's the same database. Think about our house, and we just put a new coat of paint on the outside. So we changed our name, and we have a new logo. And the website, the people, the resources, it's all the same. So yes, anything you'd already entered into the website, it's still there waiting for you. And you have the same account, same username, password. Okay, thank you all so much. And I'm going to send this back to
Carol.
Okay, there you go.
Thank you so much, Adriana. Excellent presentation. Thank you so much. There's so much information. So we have approximately 7 minutes before we get to the top of the hour. So the sharing session, we're going to add on our next month to our sharing session for this month. So I'm going to move the slides to our homework for this session. So this is the homework that we would like the Interact team to be working on for this month. This is all the work that Adrienne has talked about. So prior to your next Interact team meeting, the team leader will verify that your facility is registered for the NNHQI campaign, formerly known as Advancing Excellence. If not, the team leader will register the facility. Now, give me a few minutes. We have that a beautiful getting started checklist that I'm going to be going through with you. So if you don't know how to see if you are registered or not. You will in a few minutes. So the second bullet point for prior to your next team meeting, the team leader will also complete the data use agreement checkbox on the campaign website. And again, I'm going to address that in just a few minutes. And then finally, the team leader will download the tracking tool to a facility computer on a shared drive. Remember what Adriana says, this is a workbook that has patient-level data in it. You are not going to share it to your personal computer, or you're not going to share it to Qualidine. It's going to stay in-house, just like it's a medical record. So that's why you're going to keep it on a facility computer. And again, I'm going to talk about that briefly when I go through the checklist. So that's prior to the next meeting. Now, during the next team meeting, the team's going to decide who's going to input the data into the tracking tool. And you're actually going to name the names within the minutes of your meeting. So whether it's, you just don't want to put it to one person, because who's going to do it on the weekend, or who's going to do it at night, or is it going to be just a daily thing at the end of the day shift? But you need to document the names. Also, the team will discuss how and when the data will be entered, and the team will review the tracking tool together. So you're going to have, what I would recommend, bring up these slides, have them in front of you, and then also have the tracking tool in front of you on your computer, and just go through it to see how easy it is to enter the data. So then after the team meeting, the team leader will discuss the tracking tool and the reports that will be available with your leadership, including your medical director. Again, you want to be as transparent as possible. You want to make sure that they are accountable for all the work that your team is doing, and that they're going to talk about it when they do their walk rounds, and asking the staff, what do you think about Interact? Because you want to make sure that it's going to be engulfed into your patient safety culture. This is now the new culture, and it's not just a one and done thing. This is how it's going to be for this time moving forward. Okay, so as I promised, I'm going to talk to you about that getting started checklist. Now, this was also part of a link that was we have sent you in your registration, your reminder that the Interact webinar was on today, so you can print it down. It's the National Nursing Home Quality Improvement Campaign Getting Started checklist. So the first thing you want to do is this on the checklist. I know I am registered for the National Nursing Home Quality Improvement Campaign. The first bullet is don't know, so we have to search for your home, or I'm not, or I know I'm not registered. So what you want to do is, if you know you're not registered, you go to the campaign homepage at www.nhqualitycampaign.org. And that's right there on the slide. Click on the sign-in button, which is on the top right-hand side of the page. You're going to click on the sign-in register link. You're going to join as a nursing home, and you will need to answer the questions and set up a username and password to register. Okay, the second question is, do I know my username and password? If you do, you're going to go ahead and type it in. If not, if you are registered but have forgotten either of these items, you need to click on the Forgot Your Username /password link. You will then email your nursing home provider number, or you will then enter your email address or your nursing home provider number. You will then get a confirmation message indicating the email addresses to which the access link was sent. A link will be sent to those addresses following access to the account. Once in your account, you may update your profile and reset your username and/or password to make sure that you can remember it. If that doesn't allow you access, then click the Help button for further assistance. The next item on the Getting Started checklist is I have provided permission for the campaign to share my data with Qualidine. If no, then when you are signed into your account, the word sign in will read sign in as. As you can see here, it's sign in. This is a made-up name as My Home 2016, but it will be your username. You're going to hover your mouse over these words to access your account menu and select My Profile. You see where it's highlighted. Once you get into the My Profile landing page, you will need to scroll down the page to find a checkbox to share your data with Qualidigm, the Connecticut Quality Improvement Organization, or the QIO. Be sure to click the gold button that says Update at the bottom of the page to save your work. And that will allow us to view your data, which is part of the participation agreement in order to get your participation certificate at the end, so we can see that you are submitting for the data. Again, that's one of the requirements of this initiative. The final item on getting started checklist is to download a copy of the hospitalization tracking tool for 2017 and save it to your computer at your nursing home. Now, this is the home page of the National Nursing Home QI campaign website. You will click on the gear icon, which is right there in the center, which is Get, and then click on the link for hospitalization. The workbook is posted on that page. You will download the zip file, open it, and once you are looking at the welcome page of the actual tracking tool, this is where you're going to save it to your computer using the Save As option. As you save the workbook, change the name to include 2017 at the beginning of the file name. And finally, download the instructions for the tracking tool, which should then be reviewed by the team this month. I know that was really fast, but we only had a few minutes to go over that. But again, you have the slide, which has all the instructions.
Thank you very much, Carol. That was very comprehensive. And thank you again, Adrian. I do want to say, again, you are not alone in this. Please feel free to call Florence. I know that many of you are working with Florence Johnson on other projects. We will help you and help you get this done. We'll come out to your facility. We can do it together. This is important for you. It's important for us. It's important for our patients. So thank you again for your attention. Thank you, Carol, Olivia, and Adrian, and have a wonderful day. And we'll be talking again soon.
And thanks, everyone. I just have a few last announcements before we have the call today. When you close out this webinar, the evaluation will automatically pop up on your computer. If you could please fill it out, we would really appreciate it. You don't have time to fill these out right now, or you're currently sharing this computer with someone else. You'll receive an email tomorrow morning with a link to the eval as well as a link to the event page on our website. The PowerPoint presentation is already on our website. The link is in chat, and within the next few business days, our recording and transcripts will also be added. Be on the lookout for emails about our next webinar in May. Make sure that you register for the webinar. Thanks again for attending, and have a great day, everyone. Thanks, Sheila. Bye-bye.
The reader has disconnected. The conference will be terminated in 5 minutes.